Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've come in today because I'm quite concerned about a few things, particularly my medications. It's been increasingly difficult to get my prescriptions renewed due to recent policy changes. I've been on paroxetine and lorazepam for my PTSD and anxiety respectively, and those were working well for me. But now, accessing them is becoming a real challenge.
I understand your concerns. It's important we make sure you have access to medications that help you manage your conditions effectively. Tell me more about how these challenges have been affecting you.
Well, aside from the stress of not knowing if I can get my meds, the lack of consistency is taking a toll on me. My anxiety levels have been all over the place, and I don't feel as stable as I did when my medication regimen was consistent. Also, managing my pain and my lipid levels has been difficult without regular medication.
You mentioned issues with pain management and your lipid levels as well. Could you elaborate on those concerns?
Yes, my triglycerides have been high, and I was previously managing that with gemfibrozil and niacin. But I stopped niacin because of the side effects, and now I'm worried about my heart health with my triglycerides still high. As for the pain, I've had chronic pain from previous neck surgeries and my lower back. I'm on NSAIDs, tramadol, and hydrocodone, but I'm constantly assessing whether they're doing enough, considering the side effects.
It's crucial to find a balance that manages your pain without overwhelming side effects. We'll review all of this today. You also mentioned skin growths?
Yes, there are some growths on my hands. They're irregular and vary in size. I was told to monitor them and consult dermatology if there are changes. It's another thing on my mind, considering my family's medical history with bone cancer and polyposis.
Monitoring for any changes is wise. Let's make sure we also discuss any preventive measures and possibly schedule a consultation with dermatology. How has all this affected you day to day?
It's been tough. I'm a chemistry teacher, and I love my job, but these health issues are making it hard to keep up with my responsibilities. Managing my classes, the Model UN Club, and keeping active, which helps with my mental health, has become more challenging.
Maintaining an active lifestyle is beneficial, especially for managing anxiety and pain. It's important that these issues don't prevent you from doing what you love. Regarding your mental health, have you felt supported by the healthcare professionals you've interacted with?
Honestly, it's been mixed. I sometimes feel like my concerns are overlooked because of my PTSD diagnosis. It's as if the stigma around it clouds their judgment, which makes me hesitant to seek help.
I'm sorry to hear that. It's important that you feel heard and respected in your healthcare experiences. We will make sure to address all your concerns comprehensively today. Let's start with a thorough review of your medications and discuss the best approach to managing your conditions effectively.
I appreciate that, doctor. I just want to feel stable and manage my health without these constant worries.
Absolutely. Let's take a look at your recent lab results and see what adjustments we can make. Your lipid panel shows that while your LDL and total cholesterol are under control, your triglycerides are still elevated at 250 milligrams per deciliters. We need to address this to reduce your risk of cardiovascular issues.
What do you suggest for managing that?
Considering the side effects you experienced with niacin, we might look at alternative options like omega-3 fatty acids, which can help reduce triglycerides. As for your pain management, we can consider adjusting your NSAIDs or exploring non-pharmacological therapies like physical therapy or acupuncture, which might be beneficial.
And my medications for my mental issues.
For your mental issues, I'll ensure that your prescriptions are renewed consistently. We might also consider therapy options to support your medication treatment, like cognitive behavioral therapy.
That sounds comprehensive. Thanks for taking the time to go through everything.
Of course. I'll write down all the changes and renewals we discussed. Let's schedule a follow-up in 3 months to assess how these adjustments are working. If you have any issues or concerns before then, please don't hesitate to contact us.
Will do. Thank you for your help today.
You're welcome. Take care and see you at the next appointment. We'll keep working on making sure you have the support and management needed to maintain your health and teaching activities.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. Thanks for seeing me on such short notice. I've been a bit worried about my fasting glucose levels lately. They seem to spike despite my careful diet, and I suspect it might be due to the small snacks I have before bed.
Good morning. It's important that we discuss any concerns you have about your health, so I'm glad you brought that up. Let's take a look at everything today. How have you been feeling otherwise?
Well, besides the glucose issue, I've been managing okay. However, I've noticed some persistent pain in my left calf, where I had the vein removed for my bypass surgery. It's not debilitating, but it's uncomfortable, especially after my workout sessions.
That's understandable, especially with your history of cardiovascular interventions and the bypass surgery. We'll need to keep an eye on that pain. How about your diabetes management overall? You mentioned some diet control and regular exercise.
Yes, I've been quite disciplined with my diet and physical activity. I work out 3 times a week and monitor my meals closely, but managing diabetes is always a bit of a challenge. My last HbA1c was around 7.2%, which is slightly above my target. I've been tracking my blood sugar levels regularly. My fasting levels are usually around 126 milligrams per hour, and my postprandial levels after meals are around 138 milligrams.
Those are fairly good numbers, but I see your point about the HbA1c. It shows there's a bit more we can do. You're doing an excellent job with lifestyle management. which is crucial for diabetes and cardiovascular health. Have you had any recent issues with your blood pressure or cholesterol?
My blood pressure has been fairly stable, usually around 132/76 mmHg, which I think is acceptable. As for cholesterol, I'm on simvastatin, and my total cholesterol is at 990 mg, with LDL around 105 mg/h and HDL at 45 mg. My cardiologist seemed satisfied with these during my last visit.
Those are solid numbers considering your history of heart disease. It's good to hear that your cardiologist is pleased. Now, regarding your medications, any issues there? Refills or adjustments needed?
I need to sort out a refill for my lisinopril and possibly discuss an adjustment. With my upcoming travel plans, I'd like to ensure I have enough medication. I'll be away for 3 months, and I'm trying to get everything organized to avoid any gaps in my medication.
Absolutely. We'll make sure you have enough medication for your travels. It's critical to maintain continuity in your treatment, especially with your conditions. When do you plan to leave?
I'm starting with Christmas at my son's place, then heading to St. Petersburg Beach right after. I've already begun discussing this with my previous doctor, but then I had to transition to you since he graduated.
Transition periods can be challenging, but I'll make sure we review everything thoroughly. Your proactive approach is very helpful. I'll get all the prescriptions updated today. Have you had your tetanus booster? It's been 10 years, right?
Yes, that's right. It slipped my mind with everything else going on. I should probably get that before I leave.
We can arrange that for you today. Before we conclude, let's recap your current status and our next steps. Your diabetes is generally well managed with diet and exercise, but we'll aim to fine-tune your treatment to lower the HbA1c a bit more. We'll keep monitoring your cardiovascular health closely, especially considering your past surgeries and stents. I'll ensure all your medications are refilled and provide the necessary prescriptions for your travel. Also, we'll address your calf pain, as it seems linked to past surgeries. We should keep an eye on any changes. Finally, we'll administer your tetanus booster today. Does that sound good?
That sounds great, Doctor. I appreciate you taking the time to go through everything so thoroughly. It helps to have a clear plan, especially with the traveling coming up.
Of course, it's my job to ensure you're fully prepared and healthy for your plans. I'm here to help you manage your health, whether you're here or traveling. Let's get you scheduled for that booster, and I'll have the nurse assist with the prescription details.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
The number of patients in the ER has doubled this week. We need to find a way to handle this influx without compromising care quality.
I agree. One idea is to implement a triage system that can quickly identify and prioritize the most critical cases. This way, we can ensure that those who need immediate attention are seen first.
That's a good start. We could also consider reallocating some staff from less busy departments to the ER during peak hours. It might help manage the load better.
Yes, and we should also look into streamlining our discharge process for patients who are stable and just waiting for final paperwork. This could free up beds more quickly.
Another option is to increase our use of telehealth for follow-up consultations. This way, we can reduce the number of patients who need to return for minor issues.
We should also work on educating patients about when to seek ER care and when to use urgent care or primary care. Many come to the ER for non-emergencies.
All these are great suggestions. Let's draft a plan and present it to the administration. We need their support to make these changes effective.
Now look at question 26.
Our patient, Mr. Thompson, is experiencing severe psychosis. We need to develop a comprehensive care plan for him.
First, we should ensure his safety. He needs a secure, calm environment to minimize stress and potential triggers.
Agreed. We also need to establish a clear medication regimen. Antipsychotics can help manage his symptoms, but we must monitor for side effects.
In addition to medication, we should incorporate therapy sessions. Cognitive behavioral therapy could be beneficial in helping him manage his thoughts and behaviors.
We should also involve his family in his care. Educating them about his condition and how to support him can make a big difference.
Absolutely. We can also connect him with community resources, such as support groups and mental health services, to ensure he has ongoing support.
Regular follow-ups are essential. We need to monitor his progress and adjust the care plan as needed.
Let's also ensure all staff interacting with him are aware of his condition and trained to handle any potential crises.
Agreed. A multidisciplinary approach is crucial for his recovery. Let's finalize this plan and discuss it with the team.
Now look at question 27.
With the current demand in acute care, we need to prioritize patients effectively. What criteria should we use?
I believe we should prioritize based on the severity of the condition. Those with life-threatening issues should come first.
That makes sense, but what about patients with chronic conditions that are worsening? They also need immediate attention to prevent complications.
True, but if we don't address the most severe cases first, we risk losing lives. We can have a secondary tier for those with chronic issues.
Another factor to consider is the potential for recovery. Patients with a higher chance of full recovery with immediate care should also be prioritized.
We must also consider the resources available. Some cases might require extensive resources that we need to allocate judiciously.
Communication is key. We need a transparent system where patients and families understand why certain cases are prioritized over others.
Agreed, we should also regularly review our criteria and outcomes to ensure our prioritization system is effective and fair.
Let's create a comprehensive guideline that incorporates these points. It should be flexible enough to adapt to different situations, but clear enough to follow consistently.
Now look at question 28.
Mr. Smith, I understand you've been experiencing some cognitive difficulties lately. Can you tell me more about what you've noticed?
Yes, I've been having trouble remembering things, and sometimes I find it hard to concentrate.
I'm sorry to hear that. There are several strategies we can try to help manage these difficulties. First, have you considered keeping a daily planner or journal?
I haven't, but that sounds like it could be helpful.
It can be a great way to keep track of tasks and appointments. Another strategy is to establish a routine. Consistent daily routines can help improve memory and focus.
I'll try that. Are there any other techniques?
Yes, staying mentally active is crucial. Engaging in activities like puzzles, reading, or learning a new skill can stimulate your brain. Physical exercise is also important as it improves overall brain function.
I do like walking. Maybe I should do it more regularly.
That would be beneficial. Additionally, getting enough sleep and managing stress through techniques like meditation or yoga can also help improve cognitive function.
Thank you. I'll start incorporating these suggestions into my routine.
You're welcome. Let's schedule a follow-up appointment in a few weeks to see how you're doing and adjust the plan if necessary.
Now look at question 29.
Pacing activities after surgery is crucial for recovery, but there's always a debate on how much is too much.
I believe patients should start moving as soon as possible. Early mobilization reduces the risk of complications like blood clots and pneumonia.
True, but we also need to consider the patient's pain levels and overall condition. Pushing too hard can lead to setbacks.
That's why a balanced approach is necessary. We should develop individualized plans based on each patient's needs and recovery progress.
What about the psychological aspect? Encouraging activity can boost a patient's morale and sense of independence, aiding overall recovery.
Absolutely. However, we must ensure that patients understand their limits to prevent overexertion. Education is key.
We also need to coordinate with physical therapists. Their expertise in designing appropriate exercise regimens is invaluable.
Let's not forget the importance of monitoring. Regular check-ins can help us adjust the activity levels as needed.
I agree. A multidisciplinary approach ensures that we're considering all aspects of the patient's health. Let's work on creating a guideline that includes these points.
That sounds like a plan. Collaboration and communication are essential to make sure our patients recover safely and effectively.
Now look at question 30.
Mr. Johnson, it's important to recognize the signs of a stroke so you can seek immediate help if needed. Do you know what to look for?
Not really. What should I watch for?
We use the acronym FAST to remember the signs. F stands for face drooping. If one side of your face feels numb or droops, that's a warning sign.
Okay, I got that. What's next?
A is for arm weakness. If you feel sudden weakness or numbness in one arm, it could be a stroke.
Got it. And the S?
S is for speech difficulty. If you have trouble speaking or your speech becomes slurred, it's another sign. Lastly, T stands for time. If you notice any of these symptoms, it's crucial to call emergency services immediately.
I see. So face drooping, arm weakness, speech difficulty, and acting fast.
Exactly. Time is critical in treating a stroke. The quicker you get help, the better the chances of recovery.
Thanks for explaining that. I'll make sure to keep an eye out for these signs.
You're welcome. If you have any questions or notice anything unusual, don't hesitate to reach out. Your health is our top priority.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we'll be exploring the profound changes that astronauts undergo during and after spaceflight, supported by case studies and scholarly articles. Spaceflight presents a unique set of challenges to the human body, primarily due to the absence of gravity. This environment leads to a cascade of physiological changes that affect nearly every system in the body. The lack of gravitational pull results in fluid redistribution, muscle atrophy, bone density loss, and alterations in sensory perception, among other effects. Let's break down these changes and understand their implications. One of the most immediate effects of microgravity is fluid shift. On Earth, gravity pulls bodily fluids towards the lower extremities. In space, however, these fluids redistribute towards the head. This shift can cause facial puffiness, nasal congestion, and increased intracranial pressure. Harvard researchers have documented cases where astronauts experienced vision changes due to this increased pressure, leading to a condition known as spaceflight-associated neuroocular syndrome, SANS. A case study published in the New England Journal of Medicine highlighted the experience of Dr. Mike Barrett, an astronaut who reported persistent changes in his vision after a long-duration mission. His symptoms included optic disc edema, globe flattening, and a hyperopic shift in his vision. Post-flight MRI scans revealed structural changes in the optic nerve and surrounding tissues, underscoring the potential long-term impact of microgravity on ocular health. Musculoskeletal health is another major concern in space. Without the constant pull of gravity, muscles and bones undergo significant atrophy. Studies show that astronauts can lose up to 20% of their muscle mass on a 6-month mission. Similarly, bone density can decrease by 1 to 2% per month. The Harvard research team has been at the forefront of studying countermeasures to these effects, such as resistive exercise regimens and pharmacological interventions. For instance, a study conducted by Harvard's aerospace medicine team examined the efficacy of high-intensity resistive exercise and bisphosphonates in mitigating bone loss. The results were promising, showing that these countermeasures could significantly reduce bone density loss, although not entirely prevent it. This has critical implications for planning long-duration missions, such as those to Mars, where maintaining astronaut health is paramount. Another area of concern is the cardiovascular system. The fluid shift mentioned earlier can lead to changes in cardiac function. In space, the heart does not have to work as hard to pump blood against gravity, which can result in cardiac atrophy. Moreover, the reduced plasma volume and red blood cell mass can lead to orthostatic intolerance, where astronauts feel dizzy or faint upon returning to Earth's gravity. A comprehensive review in the Harvard Gazette detailed how astronauts often undergo extensive cardiovascular reconditioning after their missions to regain their pre-flight health status. A notable case is that of Dr. Serena Onon Chancellor, who spent 197 days aboard the International Space Station, ISS. Post-flight evaluations revealed a significant reduction in her cardiovascular fitness levels, necessitating a rigorous rehabilitation program. This case underscores the importance of ongoing cardiovascular monitoring and tailored exercise programs for astronauts both during and after their missions. Sensory perception and neurovestibular function also undergo significant alterations in space. The lack of a stable gravitational reference can lead to space motion sickness, a condition experienced by many astronauts during the initial days of their mission. Over time, the brain adapts to the new environment, but this adaptation can lead to challenges upon return to Earth. Harvard's research has shown that astronauts often experience balance disorders and spatial disorientation after long-duration missions, necessitating vestibular rehabilitation. Behavioral health is equally crucial in the confined and isolated environment of space. Prolonged missions can lead to psychological stress, sleep disturbances, and mood changes. Harvard psychologists have been studying the impact of isolation and confinement on mental health, drawing parallels with terrestrial analogues like Antarctic expeditions. Their findings emphasize the need for robust support systems, including virtual reality relaxation techniques and real-time psychological support from Earth. To illustrate, a study published in Harvard Health Publishing examined the mental health of astronauts during a simulated Mars mission. The participants reported increased stress levels, sleep disturbances, and mood swings. However, those who had access to virtual reality environments designed for relaxation showed significantly better psychological outcomes. This study highlights the potential of innovative technologies in supporting the mental well-being of space travelers. The field of space medicine is continually evolving as we prepare for longer and more ambitious missions. The insights gained from research conducted by institutions like Harvard are invaluable in developing strategies to protect and enhance astronaut health. From countermeasures against bone and muscle loss to advancements in behavioral health support, the integration of multidisciplinary research is crucial in addressing the complex challenges of spaceflight. As we look towards the future, the lessons learned from space medicine will not only benefit astronauts, but also have far-reaching implications for healthcare on Earth. Conditions such as osteoporosis, muscle wasting, and cardiovascular diseases can potentially benefit from the innovations and discoveries made in the unique laboratory of space. Thank you for joining us in this comprehensive exploration of space medicine and its profound impact on human health.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
In this session, we will delve deeply into the management of opioid use disorder in hospitalized patients, integrating insights from a recent case that illustrates the complexities and the interdisciplinary approach necessary for effective management. In managing opioid use disorder, especially in a hospital setting, it is crucial to adhere to updated clinical guidelines that incorporate comprehensive care strategies. Let's discuss the case of John, a 45-year-old male admitted to the hospital with severe cellulitis on his left arm, a common complication arising from intravenous drug use. John has a documented history of opioid use disorder, primarily heroin, for over 2 decades. On admission, he exhibited signs of opioid withdrawal, including agitation, sweating, and tremors. The clinical team faced the initial challenge of managing his withdrawal symptoms effectively to stabilize him for the treatment of his cellulitis. According to the American Society of Addiction Medicine, the management of withdrawal in hospitalized patients should prioritize safety and comfort, aiming to prevent complications and facilitate further addiction treatment. One of the first steps taken in John's care was implementing a symptom-triggered therapy using methadone. Methadone is a long-acting opioid that is effective in smoothing the peaks and troughs of withdrawal symptoms. Administering methadone not only helps in alleviating withdrawal symptoms, but also in stabilizing the patient's emotional and physical state, allowing for further interventions to be more effective. Research shows that a starting dose can be tailored to the severity of the withdrawal symptoms, assessing and adjusting the dose based on the patient's response. Furthermore, during his hospital stay, John's treatment team, consisting of hospitalists, addiction specialists, and mental health professionals, worked collaboratively to address both his immediate medical needs and his underlying substance use disorder. This interdisciplinary approach is supported by the guidelines from the Society of Hospital Medicine, which emphasize the importance of addressing opioid use disorder comprehensively within the hospital setting. In terms of diagnostics, comprehensive laboratory tests were conducted to assess for common complications associated with intravenous drug use, such as HIV, hepatitis B and C, and other infections. These tests are crucial as they help in tailoring the treatment plan to address all aspects of the patient's health needs. Another critical aspect of managing opioid use disorder in hospitalized patients is the consideration of pain management strategies. John required surgical intervention to treat his cellulitis, which involved discussions on how to manage pain effectively given his opioid use disorder. The consensus now, as reflected in recent studies, suggests that patients on buprenorphine should not have their medication discontinued, as it may lead to inadequate pain management and destabilization of their opioid use disorder treatment. Instead, pain management should include the continuation of buprenorphine with the addition of other non-opioid analgesics and, if necessary, short-acting opioids at adjusted doses to account for tolerance. Upon nearing discharge, planning began for John's transition out of the hospital. This phase is often where effective treatment can falter if not properly managed. The discharge plan included referrals to outpatient addiction treatment services, arrangements for continuation of methadone maintenance therapy, and linkage to community resources to support his recovery journey. Studies underscore the importance of ensuring continuity of care through structured discharge planning, which significantly reduces the risk of relapse and readmission. Managing opioid use disorder in a hospital setting requires an informed, empathetic approach that extends beyond treating the immediate medical issues. It necessitates a structured, multidisciplinary strategy that addresses withdrawal management, associated medical conditions, pain control, and detailed planning for post-discharge care. This case of John illustrates the complexities involved and the potential for improved outcomes when comprehensive guidelines are meticulously applied. As healthcare providers, it is our responsibility to stay informed about the latest guidelines and to advocate for systemic changes that facilitate access to necessary treatments for all individuals suffering from opioid use disorder. This includes supporting policies that improve access to life-saving treatments such as methadone and buprenorphine, and enhancing training for healthcare providers on the intricacies of addiction medicine.